Hi, my name is Eddie Lee, and this is a presentation on immigration public health. To begin with, what is immigration? Immigration is the process of moving from one country to another. In the US, immigration rates have steadily grown since the 1970s, and currently, roughly 10% of the population in the US is made up of immigrants, totaling about 45 million people. These statistics are a sign that immigrant population in the US might boom in the upcoming years. The graph here shows the immigration in the U.S. and talks about some of the topics we've discussed in the previous slide. The blue line shows that immigrant share in the U.S. stays at about 10 to 15%. Despite this, however, the immigration population has exploded in recent years. Since the 1970s, the population grew from 10 million people to 45 million people. So with a growing demographic beginning to form and make up a decent chunk of the US population, how might we address the health of these people? The answer is immigration public health policies. So what is immigration public health and what exactly is it, or why exactly is it important? To begin, immigration public health focuses on the well-being of immigrants as they enter and settle in the nation. Many different factors should be taken into account when speaking about the health of immigrants, and policies are put in place to ensure the factors of well-being are maintained. As immigration increases in the U.S., ensuring the health of the population is an important topic to discuss in the public health scene. Now that we have a pretty decent understanding of immigration public health and its importance in our society, let's talk about some factors that can affect immigrant health. To start, physical health is an important variable. The physical status of immigrants as they are being processed and when they settle in the nation is vastly different compared to native U.S. Americans, and many things are a cause of that. Mental health is also a pretty massive obstacle in maintaining immigrant health due to the stressful nature of immigration causing issues with development and maintenance on the mind, and a lot of the situations that arise due to refugees and asylum seekers and all of that. The final big topic to discuss is access to public health. For many reasons, immigrants are very limited to access to good public health services, and the availability for immigrants to find a safe environment to receive health treatment is pretty low, as many immigrants have a fear of interaction with government agencies. So, what are some things that can impact the physical health of immigrants? The first is job type. Immigrants are more likely to work high-stress jobs in fields such as service, construction, and other manual labor jobs. A diet can affect health very, very largely because many immigrants have low-income diets that are pretty high on carbs, pretty high on sodium intake, and pretty low on just about everything else, fruit, vegetables, all that. Wealth is a pretty large factor because immigrants are paid less in comparison to US born citizens and as a result have less access to resources. The immigration process itself can be pretty physically laborious because the process in some cases is very physically dangerous due to conditions of detention centers that serve as temporary housing for immigrants. So as you can see on the chart, the job percentages of immigrants versus US-born workers is drastically different. Uh, the majority of US-born workers work in management, business, science, and art on top of sales and office work. So these kind of jobs aren't very physically dangerous and physically hard on you to work day in, day out. In comparison to that, foreign-born workers are working in construction, natural resources, maintenance, production, and transportation, uh, and material moving. These are things that are much harder on the body and also really, really dangerous because of situations that can just occur on the job. You aren't really going to be in danger of physically hurting yourself at an office job compared to a construction site. So this is a chart showing the wage gap in America. uh, immigrants versus natives, and it's a pretty hard chart to read, but basically in the blue, these are native or these are immigrants that have been in the nation for 0 to 5 years, and orange 6 to 10, gray 11 to 15, tan 16 to 20, and white 21 to 23 years. And as you can see, the longer they stay in the nation, the smaller the wage difference is in natives versus immigrants. However, in those initial years, the gap is massive, negative 13.5%, negative 12.7%, negative 12.9%. Luckily, in recent years, it's dropped a pretty sizable amount to negative 9.8 in comparison to negative 13.5. However, that gap is still very, very big in comparison to, no gap at all. So these are some photos of the state of detention center camps in the U.S., and these camps serve largely as housing for people going through customs and people who are caught by ICE and all of that. And as you can see, it's not the most health conscious place to stay at. Uh, Overcrowding, mixing of ages, genders, uh, it's just not that great of a place to be. One of these people gets sick and all of them are getting sick. It's just that simple. So what are some things that affect mental health of immigrants? The situation and background of an immigrant can be massively damaging. This is due to refugees seeking asylum from trauma-inducing situations and countries. Um, Another big factor is just the lack of support from the government. There is not that much in terms of programs for specifically mental health issues and mental health awareness within immigrants. So that's not very good on mental health overall in the immigrant population. Uh, Another really, really important factor is just resistance to these, to look for help from immigrants. And that's because refugees are looking for jobs, they're looking for housing, and on their record, having a mental health care issue as something on paper can be really, really hard to overlook whenever you're job searching and whenever you're going into housing. So these are some examples of traumatic events for refugees. You have people crossing rivers, crossing oceans, and risking drowning for immigration. And this is a pretty dangerous situation to be in because many families, will lose a couple of people just because of how dangerous the tides are and whatnot. Um, Another situation is mass migration due to war and natural disasters, and this migration can be pretty traumatic on people mentally. This is Division of Health Services and Refugees, and as you can see, mental health services only makes up about 3% of all health services within refugees, and most refugees, quite honestly, don't get health services, so 3% of an already small sample is not that great. The final big topic that I'm here to talk about is why is there a lack of or a lack of access to medical support for immigrants? A big part of it is health insurance. In 2019, only about 58% of U.S. immigrants had private health insurance, and that is only roughly about a little over half of the U.S. immigrant population being able to get health insurance. That's not going to bode well for medical care if you need it, and cost of medical care for sure. Fear. Immigrants fear interaction with government agencies and will often deny help due to fear generated by local immigration enforcement policies. And just the lack of health policies in general. The government lacks health policies specifically for immigrants and has made it much harder for immigrants to get the help that they need when they need it. On the bright side, let's talk about some recent changes in the National Immigration Health Policy. To begin with, the Humanitarian Standards for Individuals in Customs and Border Protection Acts creates standards that must be upheld during customs and has made it a lot more streamlined process and a safer process overall. Help Separated Families Act of 2019 has brought and reconnected families that may have been disconnected or separated from customs and immigration processes. And another big thing is medical examination of aliens. And basically, every person who goes through customs gets a medical examination free of charge. And that has been a major step in improving the health of immigrants as they're entering the borders. Medicaid expansion and Health for All Kids has made it very, very easy for immigrants to get that health insurance that they need for very cheap or in most cases free. So specifically in Oklahoma, there are a lot of different resources for immigration health in general. Sooner Care has recently expanded to allow most immigrants to get the medical insurance that they need. Catholic Charities of Oklahoma City has multiple refugee services. Aspiring Americans helps get education for immigrants. SNAP Food Stamps has helped families get a healthy and affordable diet with their food stamps. Variety of Care is an awesome clinic, or multiple clinics actually, that span across Oklahoma, and they give medical assistance to immigrants that might be in need for very low cost or in some cases free. So overall, the immigration issue is beginning to gain traction in the health policy scene. However, much work still really needs to be done to bring the standard of living and health of immigrants to a higher level. And these are my sources for the slide. Thank you for watching my presentation, and I hope I am helpful in informing you guys about immigration public health.